Well, I hate to be the bearer of good news, but the South African health minister says Omicron deaths and hospitalisations, quote, remain relatively low. They're not even stepping up restrictions, which remain at level 1, the lowest. Figures out of Gauteng show hospital admissions are slowing. Professor Tim Spector tells Sky News most people testing positive for COVID-19 on a PCR test in the UK have a, quote, milder condition that looks just like a severe cold. Echoing South African experts, he says early data suggests Omicron is milder. Despite the government telling us that hundreds of thousands of Brits are now infected with Omicron, just 15 people in the country have been hospitalised with it. Plague Island is still trending on Twitter, despite the fact that our death rate is still in decline while Europe's continues to rise. You'd think the government would be pleased to share all this good news with the British public. Instead, they're doing the precise opposite by continuing to fan the flames of hysteria. Why are they still claiming that it's, quote, too early to say if Omicron is mild? It clearly is more mild, otherwise hospitals in South Africa would be in chaos. They're not. Brits have been terrified to such a degree that many of them have locked down themselves. Streets and public transport is half empty. Pubs and restaurants are virtually completely empty. When you speak to the staff at these pubs, they say everyone is staying away because they're too scared. Scared of a variant that has killed one single person. Meanwhile, COVID testing yourself multiple times a day is turning into a bizarre new religious ceremony. The hospitality industry, already massively struggling after earlier lockdowns, is once again on its knees. Thousands of businesses face going bust. All over a variant that has killed one single person. Is this a proportionate response? Is it sensible for our government to devote overstretched NHS resources to giving booster jabs to healthy 20-somethings? A decision that's already forcing seriously ill people to miss vital screenings and treatments. Again. Have we learned nothing from the first lockdown when up to 740,000 cancer screenings were missed? More than 100,000 planned operations could be cancelled in England this winter over a variant that's killed one person. Have we learned nothing? If the technocrats actually want this pandemic to end as soon as possible, why are they deliberately suppressing all the good news that's emerging about Omicron? It's almost like they want to keep us frightened, segregated, and atomized forever. Surely not.
To get exclusive content, early access, behind the scenes stuff, and to personally interact with me, please sign up for my community at pauljosephwatson.locals.com. Link in description, and thank you for your generous support.